Hello everyone, today we are going to discussing about GERD in this video with full notes and with mnemonics. So let's move to the objective of this video. At the end of this video, we will know about the GERD, definition, pathophysiology, composition of reflux rate, risk factors, causes, esophageal and extraesophageal symptoms, diagnosis and complication, and classification of esophagitis, and finally management. Let's move on definition of the GERD. GERD is a chronic condition in which gastric content reflux into the esophagus causing symptoms and or mucosal damage due to failure of the anti-reflux mechanism. So normal reflux can occur physiologically, but GERD is diagnosed when reflux causes troublesome symptoms, esophagitis and complication. So let's move on pathophysiology. In pathophysiology, there is the relaxation of lower esophageal sphincter muscle, which is the most common cause. In case of hypotensive lower esophageal sphincter, in case of anatomical disruption, that is hydrotonia, in impaired esophageal clearance, in delayed gastric impeding, increased intra-abdominal. Let's move on composition of reflux rate. There is acid, HCl, which is the most common, pepsin, bile salts, pancreatic enzyme in duodenogastric reflux. So talking about the risk factors, with the mnemonics fat belly, F for fatty foods, A for alcohol, T for tobacco, B for BMI, increased BMI, E for eating late, L for lower esophageal sphincter relaxed drug, L for large meal, Y for young pregnancy. So let's move on causes. With the mnemonics relax, LES, R for reduce LES tone, E for esophageal clearance, decrease esophageal clearance, L for large meal, A for increased abdominal pressure, X for extra food, that is obesity. In obesity, L for LES relaxation drug, E for impeding delayed, S for sliding hernia. So talking about these symptoms which are seen in the GERD. With the mnemonics hard one, S for hard one, E for epigastric pain, A for acid regurgitation, R for retrosternal burning, T for taste sour, B for bloating, U for upward reflux, R for regurgitation, N for night symptoms. So let's move on arm symptoms. With mnemonic arm, A for anemia, L for loss of weight, A for anorexia, R for repeated vomiting, M for melena or dysphagia. So talking about the extraesophageal symptoms with mnemonic child, C for cough, H for hoarseness, A for asthma, L for laryngitis, D for dental erosion. So how to diagnose GERD? At first, there is clinical diagnosis which is common with mnemonic PEP, P for trial of PPI, proton pump inhibitor, E for endoscopy if arm feature are seen, P for pH monitoring, which is the gold standard. So talking about the upper GI endoscopy, those indications are if the arm feature are seen, long-standing GERD in case of treatment failure for screening barred. So findings in endoscopy, those findings are erosion, ulcers, strictures, barred mucosa. 24-hour pH monitoring, it is a gold standard test. It measures acid exposure time. It is used in doubtful cases like refractory GERD, pre-surgery evaluation. So talking about the esophageal manometry, it measures ADS pressure and it is done before anti-reflux surgery. Those are the diagnostic procedures. So talking about the complication with mnemonics, U be safe, U for ulcer, B for barred esophagus, S for stricture, A for adenocarcinoma, F for fibrosis, E for erosion. So talking about the early classification of esophagitis, in this classification, we all know about the grade. With the grade A, grade B, grade C, and grade D. In grade A, there is less than 5 millimeter mucosal break. In grade B, there is more than 5 millimeter mucosal break. In grade C, continuous between folds less than 75% circumference, and in grade D, there is more than 75% circumference. So we will be going to the management part. The early management is lifestyle modification with mnemonic weight. W for weight loss, E for elevate head in, I for intake avoid triggers like alcohol, oily foods, coffee, G for gap before sleep, S for head elevation, T for tobacco stop. So also we are managed of GERD by using drugs with mnemonic PAP H2, P for PPI, proton pump inhibitor, which is the first line, A for antacids, P for prokinetics, H2 for H2 blockers. So we'll be talking about the PPIs. What are the PPIs which are used in the GERD? With mnemonics Opela, O for omeprazole, P for pantoprazole, E for esomeprazole, L for lansoprazole, A for rabiprazole. These drugs are taken before breakfast. Each doses of these drugs are usually ranges from the 30 to 50 mg. So now talking about the surgical treatment, its indications are refractory GERD in PPI failure, in reflux complication, in large hiatal hernia. So procedure is fundoplication. Here we appreciate the figure. This is the normal stomach and this is after fundoplication. So thank you. Don't forget to like, share and subscribe.